Hi, I'm Dr. Ramsey Amin. I'd like to talk about the all-on-4 procedure and what's the deal with it. I hear so much about it. I have patients come into my office all the time asking about all-on-4 and what do you mean you can replace all my teeth in just one day? Well, all-on-4 is a very heavily marketed type of technique to replace all of your teeth, and either you're on your upper or your lower or both. And is it conceivable to do a one-day procedure? Yes, it is. It's something I've been doing for the last 15 years. It's called immediate dental implants. It's not that new. The procedure has a lot of popularity because there are radio advertisements, commercials, TV about this particular procedure. Well, I'd like to review some basics about the all-on-4 and things you should know about it. It's not a procedure that I particularly care for too much, mostly because it is under-engineered. What all-on-4 means is that all of your teeth will be replaced with just 4 implants. We naturally have between 14 and 16 teeth on each of our jaws. If we don't include our wisdom teeth, it's 14 teeth. So to replace all of your teeth with only 4 implants, that's a pretty substantial amount of pressure to be supported by just 4 posts. The implants are purposely put in at an angle like this or like this in order to spread out the implants as far as possible. But it has some disadvantages and some major advantages. Advantages would be it is a procedure that can be done most of the time without a bone graft. And the reason for it is the implants in the back are placed at an angle to avoid the sinuses and to avoid the nerves. Classically, the implants are placed more towards the back, but the all-on-4 procedure provides an angulated placement, which is quite common. We've been doing this for years to avoid certain structures such as your sinus or your nerve ending on the bottom jaw, which is located about right here on both sides. So if you don't have to bone graft, it becomes a very enticing procedure. The other major advantage is cost. Well, the less implants means less cost, right? And that's correct. The fewer implants, the shorter the procedure is, the less the whole procedure will cost to do. The other advantage to speak about would be that the implants can be spread out pretty far from each other with that angulation, with only 4 implants. Another advantage would be that the cost is reduced by making the bridges out of plastic rather than out of porcelain. They're called hybrids. A hybrid, just like a hybrid car that runs on gas and electric, a hybrid bridge has plastic teeth and a metal framework. So rather than being all zirconia porcelain or metal fused to porcelain, they are plastic denture teeth attached to a metal framework, which could be titanium or gold or what we call semi-precious metal. So it is very enticing, but there are some drawbacks. And in fact, I see a lot of patients who have had this procedure who have had quite a number of complications of it. All-on-4, if one implant even fails, let's say you have a building that's supported by only 4 posts, if you take out one of those posts altogether, well, it's pretty likelihood the building is going to fall down. If it's one of the end implants that fails, and implants do fail, then you're left with nothing. The bridge cannot simply hang from one side. It would have to be completely replaced. It is very difficult to just add an implant and keep the bridge. So from an engineering standpoint, it's very weak. It's weak because there's only 4 implants, and it's also weak because most of the time, most dentists are making these bridges from hybrid plastic denture teeth. That is the major disadvantage. In my office, I believe on more all on 6, all on 5, all on 8, all on 7. 4 is the absolute minimum that can be done for the lower jaw with fixed teeth that are non-removable, but I would strongly suggest 5 at the minimum on the bottom jaw and 6 at the minimum on the top jaw. That will spread out the force of your bite between all of the implants and make your bone more stable over time. Yes, you could save money, but what is saving money when you have to replace the entire thing that you paid $30,000 for in just 5 years or 7 years when all the teeth start breaking apart, which they will. Personally, I prefer to make all zirconia prosthesis, which we mean by teeth, on 6 implants or more, and be able to connect the implants across the upper jaw. We can still place them at an angle into what's called the pterygoid area, or even zygomatic implants, which are deeper and heavily angulated to avoid bone grafting. But if you're 85 years old, and perhaps not to be morbid, but you may live another 10 years, well, maybe this procedure may be the way to go because you're not likely to replace it. But if you're 50 years old and having complete and total tooth replacement, I don't see this as being a long-term replacement. You're going to end up replacing the teeth, possibly having some failed implants. The upper jaw is the weaker of the two from a standpoint of bone and bone density, bone marrow. It is far better to over-engineer it than to under-engineer it. For me personally, in my office, the cost between all on 4 and all on 6 or all on 7, there is no difference in costs. And in fact, it is the same cost for somebody to have 6 or 8 implants than it would to have 4. I make it simple for patients to choose to do it right and add structure to their dental bridges so that they last as long as humanly possible. But this is an overall review of the all-on-4. It's not a bad procedure, but it is fraught with some complications. It's heavily marketed to be a total tooth replacement all in one day. All in one day works for a small percentage of patients. It's kind of like a teaser rate, a 0% interest. Transfer your balance over to our credit card very quickly, and it'll be 0% for the first 12 months, and then it becomes 29%. So if it sounds a little bit too good to be true, it probably is. Most dental implant procedures require a long process to get to the final teeth. If you make the final teeth on the day that the teeth are extracted and they're the final teeth, they're not likely to fit very well. They are going to be plastic. They are, I call it, temporary at best. So better off to do it right, multiple visits, a few more implants, bone graft where necessary. Better to do it right than it is to do it right now. Again, my name is Dr. Ramsey Amin, BurbankDentalImplants.com. Please leave me some comments or questions below. I'm fairly quick to respond to things, and there are other videos that have more information you may find. There's a very popular one on how long bone grafts need to heal, which has about 30,000 hits on it. But I thought this would be a popular or a needed review on this particular procedure as of 2014. What is the reality with it? Again, Dr. Ramsey Amin, thank you very much, and we'll talk to you soon. Take care. Bye-bye.